So we have a couple of applications. One of the applications is a text messaging platform that is a hybrid model that uses text messaging and an application to be able to promote oral health using text messaging as a vehicle to do so. And the application is a free platform. And the idea behind that is to be able to promote overall health using this application, talking about mental health, heart health, talking about oral health, the importance of it, the importance of saliva, and also to be able to provide information as a vehicle to have the patients involved with the content in the application. The platform is called Text2Floss. We named it Text2Floss because we wanted to engage the consumers about the importance of oral health behaviors, which are brushing and flossing and rinsing. And floss was an easy terminology that we used, and an average person in the US, they feel comfortable to talk about flossing because they don't perceive it to be important enough. So we're using the floss as a tag word to promote the behaviors, which again is brushing, flossing, and rinsing. And we believe that text messaging is the most common way and effective way to educate the consumer. And is a two-way messaging platform, so we capture the data, we capture the behavior, and after 1 week they get incentivized from an oral health product. So they are continuous of doing so. Within the application, we've also created the importance of saliva. And what we've done with the saliva component is, we know that dental decay and dental disease is a pH-mediated disease. And what we've learned is that in the US, at the 8th grade class, students learn about acid and bases. So what we wanted to do is use a tool to be able to educate the students, educate the consumer about the importance of the behaviors of brushing, flossing, and rinsing. So we created a technology that would take a picture of a litmus paper, as simple as testing your pH in saliva, and you dab it into the saliva there, and that's the litmus paper. And they dab it in the saliva after you spray it in a cup. And what happens is, with our technology, you're able to show by taking a picture of the litmus paper, and once you do that, it calculates the pH level of the saliva at that time, and it stamps a time and a date, and is able to show you a graph so you can see the fluctuation of what happens in the saliva. So we want to use it as a vehicle to educate our consumer, and also use it as a way for people who have acid reflux, as a logbook to manage that. So these are the solutions that are free to the consumer, and we want to promote oral health. The issue of dealing with oral health complexity is a complex issue. So for us, we have to come up with creative ways to be able to engage the consumer to this conversation. Our PH2H initiative is available both on the iOS application and Android, and is for download for free, so the consumers can use it and benefit from the applications.